You're following novel coronavirus, but you may not have heard of Event 201. This was a fictional exercise, and here's how it ended.
The outcome of the CAPS pandemic in Event 201 was catastrophic. 65 million people died in the first 18 months. The outbreak was small at first and initially seemed controllable, but then it started spreading in densely crowded and impoverished neighborhoods of megacities. From that point on, the spread of the disease was explosive. Within 6 months, cases were occurring in nearly every country. The global economy was in a free fall. The GDP down 11%. Stock markets around the world plummeted between 20 and 40% and headed into a downward cycle of fear and low expectation. Businesses were not borrowing, banks were not lending. Everyone was just hoping to hunker down and weather the storm. Economists say the economic turmoil caused by such a pandemic will last for years, perhaps a decade. The societal impacts, the loss of faith in government, the distrust of news, and the breakdown of social cohesion could last even longer.
We're a new science channel. Subscribe to join us. This was held 3 months ago. In it, world leaders worked out the challenges of responding to a lethal coronavirus pandemic. But there's nothing nefarious about it. They happen at least once a year, and we need to do them to plan for outbreaks like the one happening now. The scenario played out like so.
It began in healthy-looking pigs, months, perhaps years ago. A new coronavirus spread silently within herds. Gradually, farmers started getting sick. Infected people got a respiratory illness with symptoms ranging from mild flu-like signs to severe pneumonia. The sickest required intensive care. Many died.
CAPS was a fictional acute respiratory infection that could cause pneumonia. And in worse cases, it gave sufferers something called acute respiratory distress syndrome, or wet lung. That can be fatal. The real novel coronavirus, nCoV, playing out now can cause this. By January 2nd, 2020, 41 hospital patients in Wuhan had it. All had pneumonia, and 29% had wet lung. 15% of that 41 eventually died. Back to the scenario. The fictional virus began in South America. After mutating, it became transmissible between humans from coughing, sneezing, breathing, and talking. Here were the stats of the fictional virus. 50% needed to be hospitalized. 14% of those hospitalized died, a 7% fatality rate across all infections. The average R0 was 1.7, meaning the average infected would spread CAPS to 1.7 people while contagious. An R0 above 1 makes a disease more likely to become an epidemic. The real-world nCoV today is between a 2 and 3, though it's still early. Here is the model event 201 used to simulate the CAPS pandemic. Because half of all cases went to the hospital, the severity of the situation was worse than today. nCoV sends just 20 to 25% of people to the hospital. Like our real world though, when CAPS sprung up, it spread to several countries by international travelers who showed mild to no symptoms. In the scenario, the virus spread to 300 of the world's largest cities. And, like nCoV, the number of starting cases was just 1 to 4. Scientists then ran the model 300 times. The R0 varied per city. Areas with people living closer together in less sanitary conditions would probably have a higher R0, but the global average sat at 1.7. This is an important point on why we should reserve judgment of nCoV's R0. China's is 2 to 3, but it may be lower in other areas. Our reality, though, is becoming more similar to the simulation. Now, we have confirmed cases in or near 24 major cities, and suspected cases in many more. Back to the fictional virus. What ended up happening? Well, as the disease spread, governments and business leaders debated who was responsible for allocating money to address the problem. The key issue decision makers faced was the lack of a clearly defined governing body organizing collective action fast enough. Some suggested the UN, but there's a problem. Local politics sometimes prevent cooperation internationally. Countries may hoard things like masks, antiviral drugs, and hazmat suits. And as of now, there's no clear way to prevent that from happening. Another issue was the lack of data. Despite it being the year 2020, there is no clear architecture that tells decision makers where healthcare supplies currently are and how we can get them somewhere else quickly. 3 months ago, there was no solution to this, and there still isn't now. The problems, unfortunately, weren't over for the simulation. Global panic was a problem. It led to economic decline and stockpiling of healthcare supplies. In a world with limited face masks, how do we prevent the wealthiest from storing them? The experts also talk a lot about misinformation. They projected this could come from governments who blame a pandemic on their rivals. We're already seeing that begin to happen with NCOV. A final issue, perhaps the biggest, was the limited supply of antivirals available. In the scenario, a hypothetical HIV drug could treat CAPS, but there was no way to prioritize who gets it before others. Some would argue it comes down to who can pay the most, but others would argue it's the workers at the bottom of the global supply chain who are most important to keep healthy. In reality, this will be a huge area of debate, and it could lead to no decisions being made. In a pandemic situation where quick action is needed, time is of the essence. Given the fictional CAPS mortality rate of 7%, total deaths from the model were 65 million. The economic effects are beyond the scope of this video, but as the fictional broadcast showed, a global recession ensued. Some things to remember in our reality: NCOV right now has a lower fatality rate than the scenario, about half. And it's also unknown if it will spread from person to person as efficiently as it did in China. We need more data. And maybe, if this simulation can go viral, global cooperation will spread faster than the virus.